Welcome. My name is Jillian Nichter. I am candidate number 8043, and this is my AICE Global Perspectives Component 3 Quality of Healthcare presentation. First, I would like to begin talking about triage. Across the US, a common system is implemented known as triage. This word comes from the French word meaning to sort, and is defined by the Cambridge Dictionary as the process of quickly examining patients who are taken into a hospital in order to decide which ones are the most seriously ill and must be treated first. This is a reliable source as the Cambridge Dictionary has long been considered reputable to the British English language. Triage is also very commonly used in places such as the ER, so as to treat in order of severity. This method requires a quick examination of each patient as they enter, usually by a triage nurse. This method is effective, but may occasionally leave room for medical oversights and patient conditions. Over to the right, we have a quick tier list of the different classifications of triage patients. So why are ERs so packed? A great part of this issue is rooted in the inability or inaccuracy of self-diagnosis of people, leading to the assumption that a small issue is worth a trip to the emergency room, as in seeing someone clutching a broken arm next to someone with a runny nose in the same waiting room. This issue concerns the low medical literacy of common individuals. As stated by ED Logics, a study published in 2013 found that only 29% of ER visits reviewed were actually emergency situations. This source is credible as it is an organization who focuses on engaging and educating people on medical literacy in the medical field, with a team of specialists in healthcare. Medical incompetence. When I say medical incompetence, I am referring specifically to the inability of medical personnel to perform their duties sufficiently, leading to the dilemma in which they render themselves or others severely inconvenienced. For example, how nurses often have to stick people's veins multiple times unsuccessfully. In a study conducted by Urban and Barnes 2020, it was found that novices in the medical field experience difficulties which cause them to make many more mistakes than seasoned workers. This source is reliable because the authors of the study are both clinical associate professors at colleges of nursing and health innovation. Discrimination and bias in medical settings. Every person is built with biases, oftentimes which are subconscious but nevertheless impact the quality of healthcare that they serve. In ER triage, patients who may be placed above others in priority of assistance due to race, ethnicity, gender expression, etc. In a qualitative study by the National Library of Medicine, emotional expressions or fears were sometimes labeled as theatrical, leading staff to withhold attention. Some of them I can tell are just playing hysterical as soon as they come in, so I stopped paying attention, said a nurse, anonymously. This source is reliable because it was written by medical professionals and utilizes a 6-month data collection and a diverse group of participants. In this image, we see that 2 in 5 Black Americans personally experienced discrimination in healthcare encounters, compared to only 21% in Hispanic populations and 5% in white. This image is from the Barrel Institute and is credible because it is a global community of medical professionals which releases reliable information via studies. Medical understaffing. The healthcare field is stuck in a difficult situation where being understaffed has become the main reason for ongoing labor shortages. This cycle begins with the existing labor shortages, forcing healthcare workers to take on massive workloads. As these professionals bear the weight of their understaffing and the burnout, the environment becomes unstable. This instability scares away many of the recent graduates or new hires in the medical field from entering this stressful environment, thus causing the continuation of the understaffing cycle. Embodied labs state Embodied Lab states, a high turnover rate exacerbates staffing shortages, creating a cycle where the remaining staff face increased workloads and stress, further driving burnout and turnover. Burnout also deters new medical professionals from entering the field. This is a reliable source because it is of a diverse professional background with scientists, educators, and technologists who have been granted multiple awards and recognition for their medical innovation. Population growth. In particular, I mean baby booms, or periods of intense increase in a population, have caused the acute overcrowding of Florida hospitals. Florida's population is growing at an exponential rate, and with that, we're seeing the intense need for more and more healthcare providers. Though, with the cycle of medical understaffing, this need has become increasingly dire. In many low-income countries, or LICs, such as Sudan and Chad, the high birth rate is accompanied by the scarce number of medical facilities, which has caused an increase in mortality and disease rate. This diagram shows the average number of children per woman in the top LICs in the world. This source, The Lancet Global Health, is credible because it is an unbiased study by medical professionals. Next, the economic factors of quality healthcare. Florida hospitals beneficially contribute towards the local economy with jobs, taxes, and the money that they make and spend. The annual hospital payroll exceeds $34.5 billion, and in Florida, the economic output is around $198 trillion. Florida hospitals support nearly 977,000 jobs statewide, according to a report prepared by the University of Florida researchers and the Florida Hospital Association. This is a credible source as it is a comprehensive and reputable institution. This visual is from the Florida Health Association and is the 2023 Economic Impact Report. Affordability rate of healthcare in Florida. A survey of more than 1,300 Florida adults conducted in 2023 found that 63% of adults experienced at least one healthcare affordability burden in the past year. 80% worried about affording healthcare in the future. Lower income respondents and respondents with disabilities are more likely to go without care and incur debt due to healthcare costs. This visual is from the Healthcare Value Hub and is credible because it offers unbiased research and statistics from an organization committed to informing on the medical sector. My solution that I propose to this issue. My solution would include 3 different tiers, which are education, promotion, and change. For education, for staff, more training skills in fields such as drawing blood, triage diagnosis, and patient treatment should be implemented into standard medical education courses. This will help to reduce the skill and discriminatory issues within how medical personnel conduct themselves. Early on in grade school as well, healthcare education classes should include self-diagnosis lessons, which will aid in lowering the potential self-misdiagnoses in the future. Promotion. The nurse call line helps those who are unsure about their situation in order to decide the necessity of the situation, reducing the number of non-essential visits to the ER in the future. Another resource is the NAFC, which offers free medical assistance to people all over the United States. If promotion and recognition increased for such establishments, it would save financially challenged families to keep healthy and safe. Change. Low compensation has partially caused the difficult cycle of understaffing and discouragement to enter the medical field because of said problem. The solution? It's easy. Pay healthcare workers more. This will encourage more people to enter this medical sector, therefore reducing the issue of understaffing. And for my team, these were our individual team solutions and what I think of each problem, or each solution. Carter, more anti-natalist policies, and increased funding of hospitals. This proposal does provide a solution to the rapidly increasing populations, but comes with a lot of cultural and ethical barriers with the anti-natalist intentions. For example, some anti-natalist intentions that we see throughout the world today can be China's one-child policy. For Delisha, an increase in medical racism regulations in order to reduce the frequency of discrimination. I like that this solution addresses the acute issue of racism, but that is all that it addresses. It does not address the main issues of understaffing and incompetence as well. Christina, no solution given. For Kai, government should provide more financial aid to poor communities and limits should be set on how much medical services can cost, which will be brought about through protests. This is an effective solution within the financial aspect of this issue, but does very little to address the issues of discrimination and sexism within the medical field. Finally, these are my sources.